Good afternoon, I'm Mabel Jung and you're watching the World Healthcare Congress Interview Zone, and I'm very pleased to have right now with me Brock Hardaway, who is CEO of Millennium Health. So tell me more about Millennium Health. Give me some background.
So Millennium Health is a San Diego-based company that does business all over the United States. We have three segments of our business. The first segment, and really the business line that built the company, is monitoring medication. Are you taking the drug or not taking the drug? And our testing can tell you definitively. The second leg of our business is pharmacogenetics, which allows physicians then to be able to identify what drug therapy is going to work best for an individual before we put them on that drug therapy and have a trial and error process. And then last but not least, the third segment of our business we're very excited about, which is using powerful data and analytics to solve healthcare problems. So we bought a company in late 2013 called RxAnty. And that company was all about using powerful analytics and data to help people use their medications more appropriately.
And you're also very focused on the issue of precision medicine, really ensuring that people take the right medications and perhaps find the ones that don't work right away before they take them.
Using genetic information for precision medicine, we then are able to, through a very simple cheek swab, so much like what you might think of as a Q-tip, we take a Q-tip swab of the patient's cheek, and then 2 to 3 days later, we're able to tell the doctor, what medication is going to work best for that individual based on their genetic makeup. So we all respond to drug therapy differently based on the way our genetic makeup is. How are we going to metabolize a drug? Some of us push drugs through the system faster than others do. So for those patients, they don't get any effect from the drugs. And for those patients that retain the drug longer than maybe the drug manufacturer intended, they may have harmful side effects from that. Those are the things that today we can actually tell a doctor and tell an individual before they ever start on a drug therapy. So that's very powerful precision medicine as it relates to medication therapy.
Now, this is a leading question, but would your work ever lead to the point where people don't have to take the medications at all, or is that the goal at the end of the day?
It's really not the goal. The goal that we have is to get people on the right drug therapy and save money elsewhere in the healthcare system. So
how would that happen?
So for example, 5 to 10% of all hospital admissions in this country are solely related to adverse drug reactions. So
side effects,
other issues, and our genetic testing can help doctors get you on the right medication so that we eliminate that. We think that 50% of those 5 to 10% of hospital admissions are avoidable, so that we could actually help you get on the right drug therapy so that those side effects go away. Not only potentially do you have a better quality of life, but you are spending less time in a hospital.
So is there a lot of waste and misuse of prescription medication in the United States now?
No question. It may be the largest growing epidemic in this country. In fact, opioids is one of the categories that's probably gotten the most press of the abuse of and prescription that's pretty rampant out there with opioid drugs. And so clearly the number of opioids being prescribed, which are painkillers, if somebody goes into the hospital or has an oral surgery, their doctor is going to prescribe some type of opioid for them to relieve their pain. And those drugs are highly addictive. And so if not managed correctly, those are the kind of patients that can really find themselves in a problem, not just from the standpoint of healthcare utilization, but life.
Okay.
I mean, you read about patients that ultimately are people that died from a heroin overdose. And the reality is we see a lot of stories around celebrities that have had heroin overdose. Heroin is the end result. These people start on some type of opioid pain reliever for legitimate reasons. And the closest thing to a opioid pain reliever once you're off of that drug is opioids. I mean, it is heroin.
Okay.
So heroin acts like an opioid, and so people get hooked on it. And so this is one of the things that our testing can help to solve, is knowing who's at a higher risk of addiction for opioid addiction.
Okay. How effective has your work been in the last several years, and where do you go from here?
The world around genetics has changed so much in the last 5 years even, that every day we're making new discoveries around drug gene associations where, we ultimately see a day when drug companies will make a drug for you. And that drug may have multiple things that it's actually doing, but it's a drug for Mabel. And that's ultimately, that's probably 5 to 10 years down the road, but there's a lot of talk today around companion diagnostics, which basically means to back the drug process of discovery up to where they're building a drug for a group of people. And clearly that's happening today in much more significant amounts than it did even 3 years ago.
With everything else that's going on in healthcare now, is this a topic that is on people's minds? Using genome information to develop drugs that are more, that are working better for people, or people are just not focused on that?
I think it's a great question. I don't think people are focused on it. I think for the most part, when you talk to people about genetics, they think about one thing, and that's cancer. And they should. Genetic information can help predict and potentially solve a lot of cancer issues that we deal with in this country. But there are so many other things related to the use of genetic information to help us in medicine today. And what we think of with pharmacogenetics is that it's the most clinically relevant, clinically actionable today. So a doctor can get our information today. We don't make them geneticists where they've got to try to figure it out. We give them what's clinically actionable on a patient, and we allow them then to make the right decision for their patients based on that information. But we provide them with a roadmap of what can be effective for that individual based on the drug therapy that they're on.
So given everything else that people are focused on, what do you want your message to be to the members of the conference this week?
Yeah, I think the biggest issue is that, one, cost is significant and it's avoidable. So we have the misuse of drugs is well over a $300 billion problem that is in fact avoidable. We can actually, with information in the hands of decision makers, primarily doctors, we can actually make a difference in this, and it's not something that's going to negatively impact the delivery of care to those individuals. We just got to be smart about how we use information and how physicians then change the behaviors of those individuals. So that's number one. Number two is the fact that every day in this country, 114 to 120 people die because of prescription drug abuse. That's a fundamental issue, that's a social issue in this country that we got to resolve. And so we can make a difference with making sure that when we start people on a drug therapy, before they ever get on it, if my 17-year-old daughter was going to go have oral surgery today, I would make sure that she has pharmacogenetic testing done to know what drug therapy she's going to respond best to, so that when she leaves that oral surgeon's office, a month later she's not addicted to an opioid, that a month after that means that she's on the streets looking for heroin and a month later is dead. We can solve this problem.
That's a pretty dramatic
and it absolutely
A to B
is,
point.
but it's happening every day.
Okay.
It's happening every day in
Fair
this
enough.
country. And the reason that people are not focused on it is because the perception is it's a drug seeker's problem. That we got these evil people that are out there dying because they're dying of heroin addiction. And reality is there's a starting point that we need to go back a month or two, in most cases, to where we see that the addiction started with a very common purpose that was largely medically related, and we can solve that problem.
Okay.
Give doctors information and let them make better decisions.
Brock Hardaway, thank you so much for your time today.
Appreciate it.
And I'm Mabel Jong. Thanks for watching.